A hidden provision in the 2,700-page Obamacare legislation will enable several million middle-class people to get free health insurance intended for the poor. This is staggering that the feds would come up with something like this. Was this a billion-dollar accident or the original intent? I'm Alan Barton. Stand by for the front page. All right, so up to 3 million citizens earning up to $64,000 a year will become eligible for free Medicaid insurance under a recently uncovered provision of Obamacare. So joining me from Washington to talk about the impact of this latest discovery is Nina Owcharenko, Director of Health Policy Studies at the Heritage Foundation. Nina, welcome. Pleasure to have you with us.
Thanks so much for having me.
So Medicaid Chief Actuary Richard Foster says this latest discovery of this provision keeps him up at night. Why is he not sleeping?
Well, I think like the rest of America, we're learning about the bill every day. There's something new and something different that wasn't told to us when it was rushed through Congress the first time around.
So the Medicaid program, of course, serves as a safety net for 50 million low-income recipients, supposed to be covering impoverished children, nursing home patients. How did this happen? Why is this provision in there where people up to $64,000 are going to be covered? And can Medicaid absorb millions more recipients?
Well, I think we first have to start off that Medicaid expansion was a cornerstone of the Obamacare health care plan. Half of the uninsured that are currently uninsured that Obama claims that they're going to cover now end up on the Medicaid program to begin with. So this shouldn't be a big surprise. This is part of the large agenda that's been moving through on Obamacare. Now the question is, can the states and the federal taxpayers actually afford this massive Medicaid expansion? I think that this addition of 5 million or 3 million new people on the Medicaid program from this one loophole is just the beginning of the tsunami of people that will end up on the Medicaid program in the long run. And no, I do not believe that the federal taxpayers or the state taxpayers will be able to handle this. We already have states in fiscal crisis. This is only going to make things worse.
So the actuarial office says the provision is mainly going to benefit early retirees. Why is that? What's the nature of this loophole?
Well, this specific loophole that the actuary is talking about is an issue of how you determine who becomes eligible for Medicaid. And the Medicaid program, as it's currently written, is based on income eligibility. And the way that the chief actuary and others are now interpreting the law, the Social Security income that these pre-retirees may be receiving will not be included as part of determining the income thresholds for being eligible for Medicaid. So this is a huge change in looking at how they use Social Security income. But I just have to point out again, this is just one loophole. Imagine the millions of people who are currently eligible for Medicaid but not enrolled. All these new floods of people are also going to add people onto the program, and employers who don't want to offer health insurance under this new health insurance scheme that start dropping health care coverage for their low-income workers. Where are they going to end up? On the Medicaid program as well. So this is really just the tip of the iceberg for these early retirees.
Here's a final question for you. Former Utah Governor Mike Leavitt says that this provision makes him wonder what other surprises we may find baked into this Obamacare law. It's 2,700 pages. Former Speaker of the House Pelosi said we have to pass it in order to find out what's in it. Now, you head the Center for Health Policy Studies. What else is in this? What else is in this legislation? You've got 3,000 pages. You've got 3 war and pieces in there. I'm sure there's more, right?
That is, and that's with all the puzzle pieces put together. The whole problem with this healthcare law, or one of the major problems, is the unintended consequences. This machine only works if everything chugs along the right way, and I can't imagine that in 3,000 pages that was rushed through a Congress without even a conference to fix how the legislative language is written, which is how this one loophole, I think, got slipped in. This is just the beginning of this, and I think that we have a bigger problem of figuring out how all this is going to work. This is why people have uncertainty in the healthcare system, why employers are uncertain about their future moving forward. This is going to have a dramatic effect, this healthcare law, for years to come. And I think that is one of the biggest reasons why they really need to start over, and we got to figure out a better way of fixing our healthcare system.
All right, thank you, Nina. You can find more of Nina Owcharenko's work at heritage.org. Why don't we bring in our panelists today, Don Watkins, an analyst for the Ayn Rand Center for Individual Rights, and James Poulos, commentator and host of The Bottom Line. James, we'll start with you. You know, Nina talked there at the end there about unintended consequences. This is one of the, you could take this and apply it to pretty much every federal program. Whenever the feds try to do something right, they keep on forgetting about the unintended consequences of their interference with the market. What do you think the further unintended consequences are of this massive legislation? And in a weird way, is it intended that there are unintended consequences that lead to chaos? Because they then get to go fix it.
You can't make an omelet without breaking some eggs, right?
Right.
I mean, why did they do this provision? Why is it buried in there? You know, Bill Clinton's answer is, why did you do this horrible thing? Is because I can, or because I could. And I think there might be some of that going on. But you know, based on the administration's initial response, which was trying to downplay this thing and try to get everyone to move on, it might have been an intentional move. Why did they do it? I don't know. I think the point here that matters to the American people and that matters to the political scene right now is legislation like this creates a ghost in the machine. You have unaccountable people who can't be identified slipping important provisions into major pieces of legislation, and we don't get to find out until it's too late.
Well, that's why we had to pass it, so we could find out what was in it. Don, you say, one of the myths here is that you have either Obamacare. People think, well, you've got Obamacare or you've got the free market. But we haven't had a free market in healthcare in how many years? Decades.
Sure, absolutely.
Decades. And did we ever have a free market in healthcare in this country? And what would one look like today?
Well, it's a hard question because, in fact, the modern medicine really arose at the tail end of the progressive era. And by that time, you didn't have the political infrastructure in order to have a genuinely free market. So what would it look like? Well, that's hard to say, but one of the things it definitely wouldn't look like is it would not have programs like Medicare and Medicaid that force you to shoulder other people's health care. I don't actually understand what the problem is here. More people are getting free health care. Isn't that a great thing? If we're giving people 65 and over Medicare, and that's moral, then why isn't it moral to give it to 62-year-olds? And if it's a moral necessity to give it to people making $40,000 Medicaid, then why isn't it a necessity to give them Medicare?
One of the bigger fallacies
$60,000?
underneath all this, and James, I'll go back to you, is the idea of a right to health care. And you'll hear people talk about this. And sometimes people who are very, maybe not leftward oriented people think there's a right to health care. What is the problem with the idea of a right, a so-called right to a material good or service?
Well, because there's no clear stopping point to where that right ends. The scope of the right could be infinite, and entitlements aren't necessarily rights. And I think that most American people, if you really press them on this, would concede and would want to concede that, well, we're doing this not because this is a right per se, but because we sort of feel better about ourselves for doing it. This is the kind of society we want to live in. It's hard to live with ourselves if we think that this particularly vulnerable class of people is put in this position. Might be morally incoherent. Might reflect some sort of common sense moral intuitions, but I think the point is that this whole program doesn't fit into a rights framework when you look at it with any degree of scrutiny.
All right, that's all the time we have. Viewers, add your voice to the mix. Would you sign up for free Medicaid if you found out you're eligible for it? Hey, why not, right? Click the comment button below. Join the discussion. For Don Watkins and James Poulos, I'm Alan Barton. You've been watching Front Page.